Dear Cameron of Scarlet's Vein Care. This month is the uh, awareness for clots and deep vein thrombosis. So, if I could get your attention just for a few minutes, it could save your life. So, please um, pay attention to what I'm saying. This is not important for me, it's important for humankind. That's why we are picking this as a month for making people aware of how dangerous blood clots are. So, of course, we've all heard of people dying of heart attack, but not many people seem to fully understand what it's like dying of pulmonary embolus. Pulmonary embolus is very much like a heart attack, except usually there's not any history of having any chest pain or heart condition. In fact, most of these people are very healthy. They've been on a long flight, or they were sitting for a long time, or they had some clotting disorders they didn't know. So what happens? They get a clot, usually in the leg, one or the other, and they present with some swelling of the leg, maybe a little tenderness, little redness, and the next thing you know, that clot moves all the way from your leg through the vein into the right side of the heart. And of course, if the clot is big enough, it just plugs the heart, so the heart can't pump anymore, and of course the heart stops and you die. So it's extremely dangerous to know what pulmonary embolus is. Deep vein thrombosis, or DVT, is a condition where you get clot in the deep system of the leg. Pulmonary embolus is when you get pulmonary means lungs. When you get a clot from your legs, goes all the way into the lungs and hurts you. So I'm not going to get too technical here. So we're trying to make it a language that everybody understands. So there's one thing I really insist that I think everybody should be aware. If you've got some swelling in your leg or tenderness, especially if in the calf area, or particularly if it was one leg as opposed to the other, this is essentially a clot or DVT unless proven otherwise. So please don't wait too long. Try to get hold of somebody that day. Talk to your doctor, your physician. If you can't find anybody, you don't have a doctor, then emergency room. And it's a very simple test. They use this ultrasound, literally just use a sound wave. There's not even any radiation involved. They look at your calf. If there's a clot, they let you know. And they give you this medicine to dissolve the clot. I call it liquid Drano. And once, of course, the clot is dissolved, then there's no danger of it going into your heart and killing you. So let's go back a little bit and see when would you get DVT. You can really get it at any age. Unfortunately, the majority of people are young, but it could be at any age. If you're overweight, or you smoke, or you're on contraceptive pill, obviously you're going to be more prone to getting it. If you had recent surgery, particularly if you've had surgery on the pelvis, or orthopedic procedures, hip surgery, knee surgery, the chances are you're very prone to getting clots. Some people have family history. They tell me that their mom, sister, brother, somebody in the family had clots for unknown reason. Extremely important to see a doctor, especially your hematologist. Let them go ahead and check you and see if you're actually prone to getting clots. There are certain medical conditions we're prone to getting clots. For example, if you've got ulcerative colitis, or you've got diverticulitis, colitis, or any kind of infection, quite frankly, you're more prone to getting clots. Inflammatory bowel disease like ulcerative colitis, Crohn's colitis, we know that they're particularly prone to getting them. And if you're on chemotherapeutic agents, or God forbid, when you have cancer, especially some cancers like cancer of the pancreas, cancer of the prostate, cancer of the kidney, these are more prone to getting clots. I remember quite a few years ago, we had a patient who had a clot in his lungs, and there was no reason for her to getting it, maybe very suspicious. So we did a CAT scan of her belly and found out that she in fact had a cancer in the kidney, and they once we made the diagnosis, they took the kidney out. It literally saved her life, not only because of the clot in her lungs, but also it protected her from getting that cancer spread. So once there is any swelling in the legs or any suspicion, please make sure you seek help. Now, what is the cure? Well, the cure, you see your doctor, they give you some blood thinners, it takes care of it. Once the clot is dissolved, then they can go ahead and put you on medication, blood thinners. And how long they can leave you on the blood thinners, it depends on your doctor. There's a little bit of controversy there, but usually you're on it about 3 to 6 months. And of course, then you have to find out why you got a clot in the first place. And based on that, they know whether you need to be on blood thinners or not. One of the areas where you get clots is in the aeroplane, especially on long flights. You want to study about almost 1/3 of people had some form of clot in their legs they didn't even know. So again, that is extremely important. If you're a flight attendant, you're a pilot, you're a truck driver, you're in the car for a long time. Even if you drive, make sure you get out once in a while and walk around. If you're a passenger in an airplane, the seats, there's not much room there between the seats, so your knees are bent. Once your knee is bent, the vein is bent behind the knee, you can get a clot there. So again, I hope this has been informative. Just remember the name of the word is deep vein thrombosis, DVT. Swelling of the legs, particularly one leg more than the other, makes you very prone. And if you get chest pain, shortness of breath, especially if you've had pain in the calf, definitely be aware that this could be a clot going to your lungs and seek help immediately. Thank you very much for your time.